ready for our walk? Thank you. When we go out in public, it's not automatic yet that we get the mask. It's certainly an adjustment without question. It can be a little uncomfortable at times because you're wearing it all day.
For Helen Lapino and her family, something as simple as a morning stroll now feels very different.
In Melbourne, we've had really alarming rises in cases very, very rapidly, so that's been really scary.
The Melbourne high school teacher is getting used to wearing a mask every day.
Increasingly concerned about going out in public, and because there's just so much community transmission, the idea that people may be infected and not even know it with the asymptomatic cases. And so from Thursday we've all had masks.
Wearing masks has been mandatory in Melbourne since last week, although clearly not everyone appreciates being forced to wear one.
The condition of entry of our stores.
Then that's discrimination, and I can have you sued personally. I'm not going to stop recording you.
No worries.
It is my right as a living woman to do whatever I want.
I can't see any compelling reason to refuse wearing a mask in public. And I think when you see the flip side of that, for how much harm this disease can cause, I think it's very little to ask.
Some experts argue there is now enough evidence to show widespread mask use can help slow the spread of COVID-19.
A mask works if everybody wears one, so that it can be a circuit breaker instead of a lockdown across, say, New South Wales, because at the moment our epidemic is so dispersed.
While there's broad support for Victoria's mask policy, there are no moves to make it national.
We know that wearing a mask in a hospital setting, if you're exposed to people with infectious diseases, will protect the wearer. Exactly how effective that is in the community is really something that we don't know.
Professor Lynn Gilbert, who chairs the Infection Control Expert Group, a body that advises the nation's chief medical officers on the virus's spread, believes it isn't necessary to force people in New South Wales to wear masks.
There's really no evidence, I don't think, that wearing masks in the community at this stage would make any difference. I think what's making a difference at this stage is the enormous amount of work that's going on, being done by public health units in the areas that are affected.
While masks are a new requirement for residents of Melbourne, they're commonplace among hospital workers across Australia.
If healthcare workers become infected, they may well spread to other healthcare workers or even to patients. We do not want that population to become as involved with the infection as has occurred in Europe and the US.
Aside from surgical masks, another common type is the respirator or N95 mask, which creates a tighter seal and filters airborne particles. Currently, Australian health workers, even those caring for COVID patients, are not required to wear them.
Many of our members have reported to us that they don't feel safe wearing surgical masks alone and that they would prefer to have access to N95 masks.
That's obviously very controversial. Our advice has been that for ordinary routine care of patients with COVID, surgical masks are appropriate. And the reason for that is that N95 masks are not that easy to wear. They need to be properly fitted.
We've certainly had a small number of staff who have contracted COVID-19.
Jonathan Barrett is the Director of Intensive Care at Epworth Richmond Hospital in Melbourne. He says any healthcare worker at the hospital who wants a respirator mask can get one.
That's medical staff, nursing staff, cleaning staff, allied health, everyone who's in that environment. The majority of healthcare workers who've contracted COVID-19 haven't necessarily caught it at work, but have caught it as part of the community they live in.
As for Helen Lapino, she and her family are well stocked with masks and ready for what could be many months of wearing them.
And we know that this is a long haul situation and that we have to be prepared for that. So we agree that the measures that are in place are needed, however much we like them or don't like them, and that this is just the way that it has to be.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.